All righty, everyone. So welcome to tonight's presentation, all about how to lose weight when you have PCOS. If you have to hop off at any point, don't stress out because many of you guys know me. I love to chat about PCOS and I could probably go on and on and on. So I will be recording it and I will probably be sending out the slide deck as well. So I will let you guys know where to look for that recording if at any time you have to hop off. So I am so excited. Many of you guys know me and I know you, but you guys know I get really fired up chatting about all things PCOS and nutrition. So if you don't know me, I am Amy Plano. I am the PCOS dietitian. And I like to say I've been helping women with PCOS before it was cool. I feel like now with Instagram and all of the things, there's lots of different dietitians doing PCOS, but I like to think I am the OG. Shockingly, I have been working with women with PCOS around since 2009, 2010, when I started a PCOS clinic with the help of the Yale fertility team. And I have been working with them ever since. So my background is pretty deep, and I've written 2 books on PCOS. I run a fun blog, which hopefully you guys run. You guys have checked out. But the main thing today that we're going to be talking about is this universal theme of PCOS and weight loss. And I know not everybody who has PCOS is overweight, but the statistics are pretty significant. I would say probably the research supports about 80% of all women that have PCOS are overweight, if not obese. So we do track some numbers in my practice, and I would say on average, the average woman with PCOS that we see in my practice has a BMI of about 42. Okay, so we are looking at some of the data. But with all of that being said, I really want to reiterate, I know we have a bunch of awesome rockstar RDs on this call as well. I just really want to reiterate that in my experience for doing this for a long time, there is no one size fits all for working with women with PCOS. Everybody's journey is different. Everybody has different, factors that go into this. So while we are going to be talking general today, I really want to reiterate the fact that obviously I am a dietitian by profession, but I am not your dietitian. So all of the information we will be chatting about today is not intended to constitute medical advice. If you are in Connecticut, I have lots of people to set you up with and refer you to if you are not hooked up with a medical team. And obviously the information is intended to be evidence-based, but I cannot encourage this enough. And I have really seen over the years, such a struggle to find good providers in the world of PCOS. And so if you are struggling to find that, to connect with the right people, please reach out to me and I will always do my best to deliver on that. Because like I said, I am a huge fan of a team approach to PCOS. And whether that be an MD, an OBGYN, a dermatologist, some exercise folks, a dietitian, a therapist, like I said, I think working with a team is so important on so many levels. So like I said, we are going to be talking in general today. But I hope if you take anything from this presentation, you understand that working on weight loss and PCOS should be a team approach. And I know there's lots of dietitians out there, but not all dietitians specialize or have experience working with women with PCOS. So I am always happy to hook you up with some of my favorite people. So let me know if you are in a state that you might need some support. So what you can expect from this presentation, like I said, I am going to do my best to deliver the information, so we will have plenty of time for questions at the end. If you have ever attended one of my webinars, you guys know I love answering questions. All that I ask is that you guys just plop them down in the chat as we go along, and I promise you I will get to as many as I possibly can. So today we're going to talk about the multifactorial thing that we call PCOS. So we're going to talk about the contributing factors, and there's a lot, and how they play into weight loss and PCOS. We're going to talk about medication. I know so many people have such a mixed feelings. It's emotional when it comes to medications, but I'm going to just give you some of my feedback as somebody who does not have PCOS, but is very insulin resistant, and talk a little bit about my experience with some of these medications that women with PCOS take. Obviously, we're going to identify some of the health risks with being overweight. And then we're going to talk about my two favorite topics, which is optimal eating patterns for PCOS and weight loss, as well as the role of exercise. So I'm going to do my best to keep it tidy. Once again, I know I have a lot of people on my call today, and you guys know I love to talk. So let me get down to it. Let's chat all things about PCOS so we can really kind of paint a big, broad picture of what it is and why our role as registered dietitians are really so helpful in helping manage this syndrome. So by understanding what's going on the inside, you guys are really going to realize that you have the power, the superpower, to manage your PCOS symptoms. Is it going to be easy? Absolutely not. Is it going to be worth it? Absolutely. So today we're going to kind of talk about big picture. And when it comes to the underlying factors, we're going to talk about the who, the what, and the how. So the who could probably be you. The who might be your clients if you're a registered dietitian on this call. We're going to look at some of the stats. The what, if you are confused what PCOS is, consider yourself part of the majority, right? When we think of PCOS, the what of it, we don't even have concrete definitions or diagnostic criteria of what it actually is. So if your mind is blown half the time when you're thinking about PCOS, if you're confused or overwhelmed, it is totally valid because it can be super overwhelming, and there is no finite definition. And then we're going to talk about the how. So understanding, kind of the how of how your body works, how it works kind of with these different systems. You're actually going to kind of leave this presentation empowered, knowing that you have the ability to change the outcome of many of your symptoms. So let's talk about the who first. So, like I said, I have been at this gig of PCOS for a long time. And so, as we know, PCOS is the most common female hormone disorder in the world. Okay, it is the primary cause of anovulatory fertility. That's just a fancy name, for for infertility linked to not getting your period. Okay, right? Like there's lots of different reasons that cause infertility, but PCOS's primary underlying one is the lack of ovulation or the irregular ovulation. It generally can impact anywhere from 10 to 20% of all women of reproductive years. And unfortunately, there is no cure. We can help you as registered dietitians manage your symptoms, but unfortunately, there is no cure. And I would imagine, as you guys will understand, the reason why there is no cure is it's really what we kind of consider a syndrome, right? It's not an actual single solitary disease, right? It's made up of like a whole cluster of different symptoms and different subclinical symptomology. And you guys are going to kind of see why it is so complex. And depending upon who you ask, what resource you read, anywhere from 60 to 80% of all women who have PCOS are overweight, if not in the obese category. So one of the things we have seen, and I know we have a lot of dietitians on the call as well, is we have been seeing an increased diagnosis rate even in the younger population, where I used to work primarily in my practice with women who were probably trying to conceive, women probably in their mid-20s, early 30s. We're starting to see a higher incidence of actually adolescents. In the kind of the not so fun part about that is because PCOS is a chronic disorder, it means if you are diagnosed at a younger age, it's a longer period of time, right, to be exposed to, an increased risk for some of these chronic diseases. So why I am so pumped in my practice when we get to work with younger women with PCOS. It's such a cool point because we can really establish good fundamental lifestyle patterns and really get them going in the right direction. So the WHO, like I said, is about 10% of the population. And so it's pretty significant, like I said. The what, okay? This is where all of our minds kind of go. We feel kind of overwhelmed when we think about this, but there is no definitive cause. So when we look at this, we have to kind of think about what are the contributing factors, right? So there's certainly no definitive cure, but we can manage many of these things from a lifestyle component, right? So let's list them all out when we think about them. So what kind of contributes to PCOS? So genes, right? There's a huge genetic component to having PCOS. Usually these genes are impacted in areas of the body like the hypothalamus, the pituitary, the ovaries. But a lot of times if we look at kind of chronologically, we look at twins, we look at families. You may be on this call and you may have a sister, may have a mother that also has PCOS or symptoms of PCOS. So there is a huge genetic component. We're obviously not, fully, sure of how it exists or why it exists, but we do know that in the setting of environmental factors that we're going to talk about, it can turn on these genes, right? So we obviously have some metabolic features, right? We have things like insulin resistance, which we're going to chat about. We have the component of being overweight, diabetes, cardiovascular disease, metabolic syndrome, right? So these are all things that we see on a clinical level with our patients. And then obviously we have endocrine features, right? You might have been diagnosed and been told you have high levels of male hormones called androgens. You more than likely have an irregular period. But the wacky part of all of this is you may have all of those things that I just identified, but you may not have polycystic ovaries, right? So the very nature of the syndrome, right? Polycystic ovarian syndrome, you can have PCOS and not have cysts on your ovaries, right? That's not one of the criterias depending upon who you ask. Then obviously there are dermatological features. So things like hirsutism, where you kind of have hair in areas you don't want to have hair. You have thinning hair, you have acne, right? So that's kind of the what, and we're going to kind of look at it from, a symptoms approach. And so why I'm drilling down on all of these factors, and while many of these things you may be kind of saying, why, Amy, are you telling me all of these things? All of these things play into how we are going to treat it from a lifestyle factor, right? So when we look at the symptoms, and in my experience, like I said, while we do have kind of what we call kind of lean PCOSers, women that might be they may not be overweight, many of those same patients who are of normal weight still experience many of these symptoms, right? The cardinal one being high level of male hormones. So those are called androgens, but you don't have to have polycystic ovaries to even have PCOS. But these are the main ones, and the main driver of all the ones you see on the screen here are really kind of interlaced between the high levels of male hormones and then the underlying insulin resistance, right? So those little buggers can create all of these symptoms. But what I am hopeful to show you is if we kind of pull the bull by the horns and we're able to optimize your eating patterns, we can help minimize all of these. Can we help them go away? Can we cure them? Absolutely not. But if you are, I would have to say that most of my patients experience the majority of all of these symptoms, like I said, in some season or the other. And some people only, exhibit, a handful of these, but I would say as a whole, because of the way in which your body works, they play off of one another, which I'm going to show you. So many women, not all women, like I said, you may have been one of my patients and you may have not been diagnosed with insulin resistance, but I would go on a limb and probably say 95% of all of the patients that we see at the Plano program for PCOS have underlying issues with insulin. Okay, so when we think about insulin, I want to talk a little bit about kind of how it works in the body. Okay, so insulin works to regulate the amount of energy in our body, right? And so when we have high levels of insulin circulating for whatever reason, that message to the body is to store body fat. Okay. If we can minimize the levels of circulating insulin, if we can keep them on the lower side and not, super elevated, then we can help tap into your energy sources that you've already created and liberate and help you lose body fat, right? So that's why, while I'm not a huge fan of special diets for women with PCOS, and we'll talk about that, I do really actually like intermittent fasting. And I'll talk a little bit about why I like it for women with PCOS, because it really helps kind of zero in on one of the biggest underlying factors for women with PCOS, which is elevated levels of insulin. Okay. And so, like I said, when we normally eat food that has carbohydrates, proteins, and fats, our body generally will release glucose into the blood system, right? When insulin is released into the blood system, in a normal functioning body, the cells open up and they gobble up the glucose, blood sugar comes back down, and we kind of go about our way. Unfortunately, in most women who have insulin resistance, their bodies do not efficiently process insulin. Okay, so you guys may have heard the analogy of a lock and a key. Okay, so for women with PCOS, after they eat a meal, and it really doesn't matter, I don't want to say it doesn't matter what it is, but I've seen, high levels of insulin and blood glucose no matter what somebody eats if they have PCOS. They look at carbohydrates and they gain 5 pounds. But the reason why this happens is for whatever reason, the insulin is knocking on the door, but there's no key to let the glucose in. So if any of you guys have had the privilege, I'm laughing, I'm air quoting, and you've done an oral glucose tolerance test, right? They give you that glucola. I want to say it's like 75 grams of pure carbohydrates. What they're trying to look for is how quickly and efficient your body mobilizes all of that sugar, right? And so that's why they make you stay at Quest for a couple hours, right? They're trying to watch and see how quickly your body will clear the levels of insulin, right? So, so a lot of times, unfortunately, your levels stay high for a longer period of time. And if we have high levels of insulin, it's very, very hard for the body to want to let go of body fat. Okay. I want you guys to think about insulin like, what we kind of consider an anabolic hormone. Okay. When its presence is high, like I said, think about it like a little shovel. Your body wants to be shoveling little piles of sugar cubes into body fat, right? So that's why women with PCOS historically, if they go on something like a Whole30 diet, or they do something like Weight Watchers and they follow it to the T. I've had women in my office like with tears running down their face because they literally gave it like 120%. And guess what? They gained weight, right? Why did they gain weight? Well, those types of diets are higher in carbohydrates, so they elevate the levels of insulin. Okay, so in a normal body, if you and your friend were doing the exact same diet, that is one of the underlying reasons why your friend may lose weight quicker and you may even gain weight. So like I said, in women who have PCOS, their bodies are less sensitive to the hormone insulin. So when they eat, their blood sugar stays higher for a longer period of time. And when that hormone is circulating, it's just not getting into the cells, right? So the body over time, the pancreas keeps on pumping out that insulin and nobody's getting through that door, right? So that's why you're going to hear today, a lot of the approaches I use with my patients, our intention is to minimize the rise of insulin after a meal, right? obviously I'm not here to, I want insulin to be normally circulating so it does its job. But my intention is to, from a diet and lifestyle pattern, can we make you more sensitive to the effects of insulin? And we certainly can. So when we look at this schematic in front of us, you can kind of see all of those symptoms that we just talked about play off of one another, right? So elevated levels of insulin, even though the body is resistant to the effects of insulin, guess who's not? The ovaries, right? So elevated levels of insulin can exert a pretty big force on the ovaries, right? And so what that does is that it increases the upregulation of male hormones. And when we have a higher amount of male hormones, right, it makes it much harder, if not impossible, for us to ovulate, right? So high levels of insulin can break through to the ovaries, right? High levels of androgens, high levels of male hormones, those buggers are responsible for a lot of the PCOS symptoms, right? So high levels of male hormones can cause acne. High levels of hormones can, impact the follicle of the hair. High levels of those types of sex hormones can facilitate more insulin resistance, right? So it's like this vicious cycle. And I can tell you, because I've worked with thousands of women with PCOS, until we're able to kind of pull you out of this cycle and start to minimize your levels of insulin, it's like being on this merry-go-round that you can never get off, right? It's like you've done everything in your power to lose weight, but you've gained weight, your insulin is higher, your symptoms are worse. So we really need to start at the root, which is really kind of mitigating your levels of insulin. And like I said, I know that everybody knows this. And I am so not one to be the bearer of bad news, but when it comes to having PCOS, I personally, in my experience, don't really feel like having PCOS is the worst part. It's having, the risks associated with having PCOS, right? So, it's like when you have PCOS on some level, it feels like your identity has been attacked, right? Many women with PCOS have, experience issues with body image. They have depression. They feel overwhelmed. But, if anybody else were to experience all of those symptoms, it's not a, it's not a question of probably when somebody kind of starts to feel bummed out. It's just a matter of time. So being overweight contributes to depression, mental health, and body image issues. Metabolic syndrome, 80% of women who have PCOS meet the criteria for metabolic syndrome. Why do we care about metabolic syndrome? Well, metabolic syndrome is a precursor for diabetes, and it's also a precursor for cardiovascular disease. When somebody has metabolic syndrome, they generally have elevated levels of triglycerides. They have what's kind of typical in women with PCOS, right? They present like an apple, right? So rather than be like a pear where we have all of our weight in our butt and our thighs, women who have PCOS tend to carry more of their weight in their middle area, and they have, a waist circumference that's greater than 35 inches. Why we care about that is that because when somebody carries their body fat closer to their organs, right, it's a much increased risk for things like cardiovascular disease. When somebody has metabolic syndrome, they have elevations in fasted blood glucose. They tend to have issues with blood pressure. And like I said, the main thing that it predisposes them to things like diabetes and cardiovascular disease. I would say my least favorite, or I don't even know how to describe it. There's no worse part of my job than working with women who have PCOS, who are overweight, who have complicated pregnancies. I can tell you single-handedly on one hand, the amount of women that I have worked with, out of the thousands that I have worked with, if they were overweight and they delivered, there's such a high risk of complications, whether it be preeclampsia, where you develop, rapid increases in blood pressure. Most women with PCOS who are overweight who become pregnant, they might have gestational diabetes, or they might have full-blown diabetes. They might give birth to a larger than typical baby, and then that baby may be predisposed to having diabetes. Premature deliveries, increase in miscarriages. So the list goes on and on and on. It is very rare in my experience, and like I said, I can only speak from my experience, where mom delivers and there's no complications. In most of my patients that I've actively worked with, mom might be in the hospital, on labetalol, for 7 to 10 days because they can't get her blood pressure down while the baby goes home. And obviously we know there's a 3-time increased risk for miscarriages when somebody is overweight and has PCOS. So once again, I am not here to tell you anything that you don't know, but what I can also tell you is if we can optimize your diet, get you moving in the right direction, we can decrease your risk for any and all of these risks right here on the screen. So like I said, the management is going to start with managing your insulin. Once again, many of you guys will come to me and you'll say, oh, it's like, I don't have insulin resistance, but the majority of patients have insulin resistance. And even if you are not formally diagnosed with insulin resistance, I can almost guarantee that you have some underlying issues going on that is feeding all of these other symptoms. But like I said, the cool part and why I'm jumping for joy is we can hook you up as registered dietitians with helping you move through all of these lifestyle patterns. So I want to talk about medication. I know it is somewhat controversial, and obviously I am not, I'm a registered dietitian. I am not an MD, but if you have ever worked with a registered dietitian, we are some pretty badass individuals, and we are trained to teach you how many of your medications work. And so I want to just highlight a couple of the ones that in my experience of working with women with PCOS, we see pretty commonly. So obviously I wanted to start off with the medications that are most prescribed for insulin resistance. So obviously metformin, many of you guys are probably very familiar with metformin. Another name for that would be glucophage. That is generally the first line of treatment for women with PCOS who are insulin resistant. Unfortunately, as many of you guys know, it also has some not such fun side effects, especially things like nausea, diarrhea, upset stomach, indigestion. I take 2,000 milligrams of metformin a day. What I have found is that taking the time release version does not give me the same amount of GI distress, but I can totally understand and relate to why some people are somewhat adverse to it. I also wanted to premise this whole talk on medication, and I really want to reinforce that the quality of your life is what's most important. I know that some people have these, people come to me and they're like, I don't want to take medication. I'm not going to take medication. I don't want to be on long-term medication. And I know while I am somewhat uncontroversial as a provider in general, I think if it's going to improve your quality of life, you should at least give it a go and try it. Like I said, I threw up on some of the GLP inhibitors probably for 8 weeks straight. I shit you not, like throw up, vomit. But I knew, given my high levels of insulin, that I probably didn't have a choice. I could either continue to be miserable, uncomfortable, or, I could really do what I needed to do and take them. But I'm not exaggerating. I threw up for 8 weeks when I started them. And that was like 8, 9, 10 years ago, before some of these meds were really kind of formulated the way that they are. So the ones that are generally prescribed for insulin resistance are metformin, things like an SGLT2. So that is a sodium glucose transporter. That's a medication we give to diabetics. It's fairly new on the market, probably the last 3 years we've seen it more popular. What that does is it inhibits the absorption of glucose in the kidney. So you guys may have seen commercials for Jardiance, for Cia, Invokana. Those are the popular ones. People who take those not only have the ability to lower their insulin and optimize their blood glucose patterns, but they also help with weight loss. Myo-inositol, that is an over-the-counter medication. And that is something you can buy online, you can buy on Amazon. Many women who have PCOS swear by that supplement. I'm not a huge supplement person in general, but when you look at the research regarding it, it's pretty significant. And in some clinical trials, it even has some better outcomes than metformin. So like I said, the standard dose for that is 2 grams 2 times a day. And why that is so helpful for women with PCOS is that it has kind of a multifactorial impact. So it improves insulin sensitivity. It can optimize egg development, which means it can improve your overall chances of ovulating. And obviously it can optimize your menstrual cycle. So like I said, and that is over the counter. And that is 2 grams 2 times per day. So those are the main ones that you may have seen or heard about. Like I said, in my experience, I know nobody wants to hear this, but in my experience, the therapeutic dose of metformin is about 1,500 milligrams a day. And so if you are somebody who's really having a hard time with it, if you're taking that 500 milligrams, on many levels, a lot of times that is not super effective. So, you may want to consider something like, the inositol, which may be a little less stressful on your system. But if you are insulin resistant and you are not taking a medication, take somebody like me. No matter what I did from my diet, no matter what I did from an exercise standpoint, if I am not medicated, my insulin goes off the charts. So for me personally, and for most of us who have any type of underlying insulin resistance, these medications are going to be super important. So like I said, while you may not want to be on medications, I can completely relate with you. But like I said, I want you to at least consider it, at least give it a good college try, maybe give it a couple tries. The other ones I wanted to highlight are things like hormone regulators. So things like obviously hormonal contraceptives, something like a Clomid, progesterone, letrozole, flutamine. Those are all medications that your fertility doc or your OBGYN might prescribe. And once again, I know people have, a very mixed approach when it comes to hormones, but for some women with PCOS, these are the only things that are going to give them back their quality of life. So like I said, nobody probably wants to be on birth control, but if it's going to optimize your cycles, if it's going to decrease your insulin resistance, if it's going to make you feel better overall, I just want you to consider it. That's all that I'm saying. And then things like symptom management. So something like, a lot of women with PCOS have issues with acne because of the elevated levels of testosterone. So the spirulactone, the tetracycline, the Vanica is actually for hair growth, and then things like retinoids, right? Those are generally going to be prescribed by a dermatologist. And then if you have if you have any cardiovascular involvement, you may be working with a cardiologist. These are just typical cardiovascular managements. I'm not going to go into those, but I know that it is controversial when it comes to weight management. I know everybody has their opinion on things like Ozempic, phentermines and butramine, so I'm not here to give my opinion, but at the end of the day, if it is going to improve your quality of life and it's going to decrease your symptoms, there should never be any shame associated with taking medication. If you're absolutely adamant against it, I totally honor and respect that. If you are for it, I honor and respect that. But if your quality of life is just going deeper and deeper down into the toilet, I just want you to think about some of these tools that you have at your disposal. Once again, none of these are a shoo-in for anything with PCOS. None of these will cure PCOS, but some of them will really help you manage the symptoms of those. Obviously, the most controversial one being Ozempic. Shockingly, this is not a new drug. It's fairly new in terms of its approach. There are some trials and studies with PCOS, and obviously the big piece with Ozempic is that it delays gastric emptying. So women with PCOS, especially women who have insulin resistance, have this chronic underlying hunger. Women who have PCOS, unfortunately, like they'll eat a meal and they'll be thinking about their next meal while they're eating. And so one of the benefits of Ozempic is that it delays gastric emptying and that it increases that sense of fullness. So for many of the women that I work with on Ozempic, one of the things they say to me is like, Amy, for the first time in my life, like I feel somewhat normal. Like I don't feel hangry all the time. Once again, yes, there are side effects. There's things like obviously GI distress, which we've already talked about. There's things like once you come off of it, obviously your hunger comes back, you know, but for some reason, if it gives you a semblance of, you know, feeling good about yourself, about your body, you know, I want you to do what feels best for you. And none of these may feel best for you, and that is totally cool. But like, I don't want you guys to believe the hype, like that there's some type of stigma associated with taking any type of medication, you know? So I want you guys to do what is best for you, do what feels best for you, explore your options, you know, but if your quality of life is not, you know, is not improving, I would like you, you know, to think about and talk to your doctor about some of the things that could be helpful. So like I said, your quality of life is most important. And we need to make sure that we're optimizing that. So that is super important. Okay. So we've talked about kind of the what, the why, the who, and now let's talk about the good shit. Let's talk about what we need to be eating optimally for weight loss. Once again, I know not every woman who has PCOS is overweight, but I would go head to head with any researcher who's going to tell me that if we cannot get women to lose even 5 to 7% of their weight, that we cannot optimize or decrease any of those symptoms, I will go head to head with anybody that can show me otherwise. So I am all for quality of life, and I understand that not everybody is overweight who has PCOS, but I think that most women who are overweight can benefit from weight loss in a sustainable manner. So like I said, some of the things I'm going to say you may not love me for, but I'm going to tell you from the real deal, like I said, from working with thousands of women with PCOS who are struggling to lose weight. So I'm going to give you my top 5. If you guys know me, I probably have top 50. I'm not going to bore you with all of the details. I want to give you guys the basics. And like I said, for me, like I said, it's really individualized. And so when we work with women with PCOS on my team, we really understand that we are running the marathon with these women. This is not a sprint, right? We are not here for short-term fix. We are not here to, you know, give you any more stress. So like I said, we are running the marathon when it comes to weight loss and PCOS. And if you are working with an amazing rock star dietitian, what they should be doing with you is meeting you where you are, right? Not where they want you to be, not where they feel like you should be, but exactly where you are. And one of the questions that drives me absolutely bananas, but I can understand why our PCOS patients ask us this, is that they say to me all the time, Amy, what are you going to do with me at the first visit? And I'm like, the hell I know. Like, I need to look at all of you. Like, I need to look to see that what's important to you. What are your goals for working with a registered dietitian? Like, what do you love to eat? What do you hate to eat? What are you not willing to eat? What do you like to do for exercise? Where are your insulin levels at? What types of medications are you on? What type of medications are you willing to try? So like I said, it's like women with PCOS are like the most homogeneous but heterogeneous population at the same time. So if you are working with somebody who is a registered dietitian, a nutritionist, who is not treating you, you know, as a unique, special individual, then we need to find you somebody else. And like I said, I can always hook you guys up with some of these rock star dietitians that I know, but we want to get you with somebody who specializes in this and is that kind of understanding exactly where you are. So like I said, there are a lot of ideal scenarios, but when it comes to weight loss and PCOS, you know, like I said, we've got to walk before we run. And I have never met anybody when it comes to weight loss that's mastered it overnight. Like, there is no harder thing in the world than behavior change. Changing your behavior is so freaking hard. Staying comfortable, that's pretty easy. So, so a lot of times, like I said, the intention when you work with a registered dietitian is to meet you exactly where you are as an individual, not necessarily, where you should be. So, like I said, as you can see, I am so not natural when it comes to pictures. So this is a fine example of like me just being awkward and weird, but don't believe the hype. There is so much information out there as it relates to PCOS. And it's coming from, many of my colleagues as it relates to specific diets. If somebody tells you there is a special diet for PCOS, they are full of shit. They're full of a lot of shit, because I would tell you, I've been doing this shit longer than anybody else. And if there was a best diet, I would be able to tell you today, but there's not. So, when you see the hype out there, like I said, about the best diets, whether it be keto, no carbs, Whole30, probably my favorite is no dairy, no gluten. Like I said, if you don't do well with gluten, that's totally awesome. If you don't love dairy, that's also totally cool. But like, don't believe the hype that that's the reason why you have PCOS. Don't believe the hype that's why you can't lose weight. There is one, it's like I said, it's like on Instagram on the daily, it's like there's so much information out there. Like I said, if you come back to that concept, there is no one best diet for PCOS. There's things that we can be doing optimally. But like I said, the intention from a dietary standpoint is we want to decrease any underlying insulin resistance. We want to decrease your weight if at all possible, because that's going to optimize all the metabolic factors, and then we can improve fertility outcomes, right? Like any diet, it has to be aimed at that. Okay. So like I said, my tip number one is thinking big picture. Like I said, I know many of our patients come to us and they have tried everything. And so they come to us and they want us to do some voodoo magic and get them going in the right direction in a very short period of time. And while we would love to do that, we also really understand that PCOS is a chronic disease. It never goes away. So what we do with you at the first session, and the second session, and the third session has to be consistent with what we're going to be doing with you on the 60th session, right? We have to make sure that what we're giving you from a dietary standpoint is something that's sustainable. So, like I said, if somebody's giving you a quick fix, like I said, the intention is that it needs to be something that you can do long-term. Okay. Now I know you guys want to kill me because you just told me that there's no such thing as a diet, but I would be lying. I would be full of more shit than I really am if I told you that women who have PCOS don't benefit from a lower carbohydrate diet. So that's why when a woman, like, what we get a lot of women that come to see us will say, I did Weight Watchers, like, in my 20s, and now I'm 30 and I just did Weight Watchers and I gained like 10 pounds. Well, Weight Watchers is historically like the OG plan. I know there's like 50 programs removed at this point, is an eating pattern based closer to 50 to 60% total calories coming from carbohydrates. So that does not tend to work well for a woman with PCOS who's insulin resistant. Many women who have PCOS, they look at a slice of bread and they gain 5 pounds. So the reality is, while I would love to give you all of the carbs of the world, I'm here to set you up for success. And 30 to 35%, it's not too little and it's not too much, so it's, we can't overload your system and really give you more than you can handle, because if we're constantly elevating your levels of insulin, we're going to be making it increasingly difficult for you to lose weight. So I have personally found, like I said, a lot of people will say to me, Amy, like, show me not in a bad way. They'll say, can I read the book that you read that showed me that women need 30 to 35%? And I'm like, there's no book. Like, this is what I've seen working with thousands of women, like I said, and everybody has a different threshold. And some women can get away with more, but like I would be lying if I told you a lot more than that. So when we are working at the Plano program with our clients, a lot of times this is the first thing we are, we are working around. So we are trying to, so for most women, in my experience, like this is less than 120 grams of 120 to 140 grams of carbohydrates. Like I said, it's really going to depend on, what their resting metabolic rate is in terms of where we start them. But like I said, we kind of play with this number and we see how they feel on that. If you have somebody that comes to see you, or if you are an individual that's consuming a diet that's 80% total calories coming from carbohydrates, I really want to reiterate those baby steps, right? So taking somebody and halving their carbohydrates is generally not going to be a sustainable way in which to approach this. So like I said, a lot of times when I'm working with my clients, I'm really looking at where they are now, right? I know where I eventually want to take them to a place like this, but there's a good possibility that, it's going to take me several months to get them here, right? Also from a blood sugar management standpoint, if somebody is consuming a lot of carbohydrates and we start to slowly remove them, they may have some shifts in blood sugar, which impacts their mood, which causes them to have increased cravings. So that's why I think it's really helpful that while we may have this number kind of as the end all in sight, if you are somebody that's consuming more carbohydrates than this, like we're going to have to start slower, So like I said, optimally, as somebody who has massive insulin resistance, I have found personally, while I love carbohydrates, even for somebody like me, I try to kind of sit kind of around that 35% total calories coming from carbs. So obviously we want those to be quality if possible. So something, when I say complex, something that is not going to spike your blood sugar really, really quickly. So, some of my favorite complex carbohydrates are things like Dave's Killer Bread, which has, a decent amount of fiber. I love things like oatmeal. I love high fiber tortillas. I love Barilla Plus, which is a pasta that is a pasta. It's not a chickpea pasta. It's a higher protein source. I personally, it's just me. I know people, I don't like pseudo products. Like I like cauliflower. I don't like cauliflower rice. To me, it doesn't taste like rice. So personally, when I'm looking at this number and I'm working with my clients, if somebody really likes that as, you know what I mean, and they rather use their carbohydrates for something else, I'm also fine with that too. But something like a simple carbohydrate, something like, a couple cups of pasta, with no other source of protein or fat in there may raise somebody's blood glucose very, very quickly and then slam them down, equally as bad. So a lot of times you guys hear the bigger the rise, the harder the fall when it comes to carbohydrates, especially with women with PCOS. That's why, like, if somebody goes out for a higher carb meal, they may feel awesome. And then like an hour later, they feel like they've been hit by a Mack truck. They're exhausted and they just ate, and like they could go back, go back for more, if not double what they ate. So that's why if we can get your carbohydrates under control, and like I said, this may take a while. Like I said, this is not something that is easy. This is something that can long-term really help you. A fistful of carbohydrates, for anybody that doesn't know this, a fistful of most, I'm air quoting over here, most carbohydrates is about 50 grams of carbohydrates, 45 to 50. So a cup of cooked rice is about 45 to 50 grams of carbohydrates. A cup of cooked macaronis, in my Italian heritage, that's about 45 to 50 grams of carbohydrates. So when I am working with my clients, it's really important for them to tell me, like, where do they want to spend their carbs, right? So I like to look at it like a dollar exchange. So if I say to somebody, I want you to have 140 grams of carbohydrates, I'm giving you $140 to spend. How do you want to spend them? Like, what do you love to eat, right? Like, obviously this is not Weight Watchers where I'm going to let you eat like gummy bears and bagels, but like, I always say when it comes to carbohydrates, it should be a little bit of what you want and a little bit of what you need, right? So Plus, if we can get more complex carbs in your diet, we'll talk about, what fiber does overall for PCOS. So that's why I like to say, use your fist, and your fist is a marker of I know everybody's fist has, everybody has different size fists, but your fist is generally about 50 grams of carbohydrates plus or minus a handful of grams. I tend to be a big fan of using an app to track. Once again, it's generally not my first mode. If I can get somebody to understand carbohydrates just visually, most people tend to underestimate how much carbohydrates they eat. So if I'm working with somebody that I know has some disordered eating tendency, I'm absolutely positively not going to have them track their food, right? But if I'm working with somebody who, is really serious and like they seem like there is a lot of distortion between what they're consuming and how many grams of carbohydrates they're taking in, that's when I find it's helpful to use something like a MyFitnessPal, a Fat Secret, a Lose It, whatever app you love to use, just to get an accurate sense. Because I am fascinated when I'm working with my clients, even when I'm looking at an app and I'm going through something like a smoothie and they have like 2 ingredients in it. It's like, almond milk and, protein powder. And I'm like, well, did you have any peanut butter? And they're like, oh yeah, I put 2 tablespoons of peanut butter. And I'm like, well, did you put any fruit? Oh yeah, I forgot, I put a couple cups of fruit, or I put a cup of fruit in there, and I put some flax seeds, and I put X, Y, and Z. So, while those are all quality sources of carbohydrates, this is probably the one, I would say this is the biggest mistake that I see most of my clients work. They're doing most of the things right, especially when it comes to carbohydrates, but that tipping point, right? That 30 to 35% or whatever, wherever we are with them, like they're like 20 to 30 grams too much every day. So that's why I think it's good, depending upon where somebody's, headspace is and kind of what their history with, kind of diet pathology is. For me personally, I found it's been really helpful to get them to log. What I even like to do better, and it's better for, is to get them to take pictures of their food. Because I know for me, I'm like a carbohydrate like calculator. Literally, you can throw anything out at me, you can show me a picture, I will be able to tell you. I probably should have been a type 1 diabetic planning for my boluses, but for me, I think sometimes when I visually see something, it's easier for me to explain to somebody. So if you are working with patients, obviously be mindful from their diet history, whether or not you want them to track. For some of your patients too, just using simple things like, the diabetic exchanges, we tend to use some of those too as well, just to get people on track. But a fistful is about 50 grams. That's an easy way to think. And if I'm saying for most women, like I said, I'm air quoting, because remember, most women is not you, and you are special and unique. So we have to come up with a pretty, we have to personalize your approach, but that's kind of what I've seen has been helpful. Like I said, I know nobody likes that part, but I would be doing you a disservice if I didn't tell you you would benefit from restricting your carbohydrates. I don't like the word restricting, decreasing your carbohydrates. Tip 3 from me, pump up the protein. So, protein does a lot of different things when you have PCOS. Obviously, it digests, it's more complex. So it digests slower, it stabilizes your blood sugar, and it allows you to feel full for a longer period of time. When you're managing your, swings in blood sugar, it's so easy to feel hangry. It's easy to feel exhausted. So if we can kind of balance out your protein with your carbohydrates and kind of stabilize you out throughout the day, I think you're going to feel so much better than you're going to feel kind of yo-yoing back around. So, I am a fan of almost all protein sources. It really depends like what you're into and what you like. So, I tend to like, all types of eggs, whether they be eggs, egg whites, frittatas, hard-boiled eggs. I really like some of the foods that are high in dairy for women with PCOS because they tend to, for whatever reason, also be deficient in vitamin D. So things like cottage cheese. I know some of you guys say you want to throw up in your mouth when I say that word, so I'll only say it once, but it's a great source of calcium. It's a good source of vitamin D. I really personally dislike low fat, no fat. I'm going to say I don't mind low fat versions of dairy. I very much dislike fat-free versions of dairy. So that's why when we talk about fat in the next tip, I'm going to kind of give you my, my 2 cents about that. But, if you like it, that's great. But like, I like, a 2% to a 4% cottage cheese. I like a 2% Greek yogurt. I feel like it is more satisfying. I feel like it is more satiating. It's hard to find, but if I can find full fat, cheese sticks for a snack, like, everything from ground chicken to ground beef, there's lots of value in red meat if that's what you like. So finding some of the leaner cuts. Also against popular opinion, I know nobody wants to hear this, but ground turkey, I know people give ground turkey like this halo effect as that it's this, super, super high quality food. The ground turkey generally has as much saturated fat as, ground sirloin. So if you don't love the taste of ground turkey, and you're just eating it because you think that it's healthier, it's still a mixture of light and dark meat. I like ground turkey for meatloaf, but as an Italian, like I would never use turkey in my meatballs. I would always use a meatloaf mix. But like I said, I want you guys to go with what feels best, but you know what I mean? So don't think, your protein sources all have to be super, super lean. I also like, for convenience, low sodium deli meats. I'm a big fan of low sodium beef jerky. If you are a gal that likes smoothies, I'm a huge fan of whey. I'm a huge fan of egg white, those brands. I am horrible with my protein, like the worst, like the worst. And so what I have found that's been helpful, and I'm not like, I'm not sold on the beauty effects of it, but I really like the collagen protein. I think it's Vital Labs. I get it from Costco. And I put it in my water just to bump up my protein. And I find that it stabilizes my blood sugar. I'm also a huge fan of like the Fairlife milks, although I have not been buying them in full transparency because I saw some of the videos where they were doing not such nice things to the cows. But another brand aside from Fairlife is Slate. They make a high protein chocolate milk, and then they make a high protein mocha milk as well. They're a little bit more expensive. And in certain Trader Joe's, not ours anymore, they also sell the high protein milk that's lower in carbohydrates. So, like I said, the Fairlife, like I said, if I could, if I wish I didn't see what I saw, but that's a really good source, especially of dairy, and there is no lactose in that brand as well. So, so I like to do some dairy for you guys in terms of your protein, just because most of you guys tend to be low in D and low in calcium. And these are helpful. 2 foods that I do not consider a protein. I do not consider peanut. If one more person tells me they put peanut butter on their bread because it was a protein and it stabilizes their blood sugar. Yes, peanut butter is great. Nut butters are great. Those are fats. Okay. They have some protein in it, but they are not considered a protein source in my practice. I love them. They're good. They're delicious, but that's not where you should be getting your protein from. Like you would probably have to do like, I don't know, like a cup of peanut butter to probably get the equivalent of like 4 ounces of chicken. And like the delta on that would be like probably thousands of calories. So once again, I'm not adverse peanut butter, but I got to do a meme or something like peanut butter is not your source of protein. And once again, I know people are not going to like this, but hummus is, obviously hummus is made from chickpeas, but to me, it's not the best source of protein because it brings a decent amount of carbohydrates. And when most people are eating hummus, they're eating a couple tablespoons or a quarter cup. Once again, it's not a horrible choice when it comes to protein. But personally, like I would put that more carbohydrate category. So once again, I'm not adverse to either of those, and I love both of those. And we probably have more nut butters in my house than I'm afraid to admit, but I don't go to the peanut butter as a source of protein. Another one I want to add, if you guys are like looking to diversify your protein sources, is are some of those higher protein waffles that are frozen. Once again, just for convenience. those frozen, like they're those sous vide things, those mini quiches. Once again, I am all about convenience and what works for you. So, those are also other quality sources, more quality, with higher fiber. Once again, it doesn't mean, because you bought Kodiak waffles that you can have the whole box. It just means that I would love you to have a couple Kodiak pancakes. Those have some protein in them. Put a little Greek yogurt on the side, put some peanut butter and a little bit of syrup, and you're good to go. You know what I mean? So balancing it out and not eating it in isolation. Just looking at the clock. I just want to make sure I have enough time for you guys' questions. So like I said, I like for you guys to include it with every meal. I have snack here because for some women, I really like to experiment with intermittent fasting. And so like you may not be snacking if you decide to do some intermittent fasting. So like if you are the type of person that benefits from eating every couple hours, I would probably make sure that I made your snack, probably under 15 grams of carbs and more protein and fat than carbohydrates. But I really honestly don't believe, I know people will disagree with me, but I'm not a super fan of small frequent meals and snacks for women with PCOS. And the reason being, I feel like for most women, it kind of throws their insulin like up, down, up, down, up, down. It really depends kind of where you are in terms of your eating patterns. So some people just like, that's how they do best in terms of staying sane. So we just have to make sure that we're optimizing what's in those meals. But like, I usually say what works for most people when it comes to weight loss doesn't work for women with PCOS. Why I love protein obviously increases your satiety, and a palm full of protein, which is about 28 to 30 grams of protein, is about 4 to 6 ounces. Okay. Once again, I find it fascinating in terms of weighing protein sources, because sometimes like the chicken breasts that I buy, even from Trader Joe's, they're like a pound each. Like, you know what I mean? I remember back in the day, like a chicken breast was a palm full, but like that is no longer the case. No matter they be organic, cage free. I just feel like there tends to be some portion distortion when it comes to protein. But I'm not going to lie, I don't think anybody gets overweight because they ate too many chicken breasts. I'm just going to throw that out there. So while I think a food scale is helpful, I like people just to kind of utilize it just to get a sense of what 4 to 6 ounces looks like. Like I said, it's not to say that you should weigh everything all the time, every day, but I think it just gives you good perspective. And for many people, they don't know where to start with that. So, tip number 4, like I said, I love me some fats. Obviously, all fats are not created equal. And like I said, I do like to include a significant source of fat. Obviously, I tend to err towards the ones that are mono and polyunsaturated fats, because women with PCOS are predisposed to heart disease. And so if we can improve the quality of the fats in their diet, we can decrease their risks and sometimes get them off some of their meds. So fats have a minimal impact on blood sugar. They increase our satiety. And the cool part when we have PCOS is that the backbones of our sex hormones are actually, steroid hormones. So like we can even optimize our fertility just by taking in sufficient amounts of fat. So not all are equal. If you are somebody who is predisposed to heart disease, you may want to talk to your OB or your fertility doc and see if maybe something like supplementing with the omega-3s would be helpful. There's some really high quality supplements out there that we can hook you up with. And most women with PCOS, who have elevated triglycerides, they benefit from about 1 to 4 grams of omega-3s per day. Even if you're eating fish twice per week, like a cold water fish, like a trout, a salmon, a tuna, most studies show that women with PCOS can benefit from supplementing. But you always want to check with your doc, because if you're on a blood thinner, and looking at your cardiovascular history is pretty important. Most people think that they take fish oil for lowering cholesterol. Fish oil is really more indicated, and targeted towards triglycerides. So if somebody has elevated triglycerides, which we tend to see with women with PCOS. It can be very helpful. And then it can be helpful with increasing any of the, if somebody has elevated levels of C-peptide, which are high levels of inflammation, that can be also helpful as well. But just like personally, I'm not a huge fan of women with PCOS taking a shit ton of supplements. Like I said, if we can just I rather let's start with your diet. Like people come in and they're like, they open up like their tote bag and it's like, I don't even know. It's like the pharmacy. And I'm always like, you don't need that one. You don't need this one. So unless you're truly deficient in something, or it's something like, or it's something that like you just really feel, makes you feel better, I'm not adverse to it, but it's always good to run down your supplements, especially if you're going to start any IVF, or anything like that. Fats that I love, obviously, I love things like avocados, walnuts. I do really like fish. I do really like the nut butters, cold pressed olive oil, avocado oil. I'm a huge fan of grass-fed butter. You know what I mean? Once again, everything in moderation. Because I think as somebody who loves food, these types of fats make our food taste good, right? So like some high quality Kerrygold or whatever type of grass-fed butter, even Aldi's now has a grass-fed one that's pretty tasty. But these foods increase the palatability of your foods, and they keep you satiated. My last tip before we jump into exercise, and I promise I am almost done, I'm not going to take up any more of your time, is really to have, like I said, to me, fiber is like, it gets superstar status. And why fiber gets superstar status in your diet is that it can lower your cholesterol. Like I said, most women with cholesterol are predisposed to cardiovascular disease. It can increase your fullness. It can optimize your blood sugar. And a lot of times foods that are high in fiber, like fruits, vegetables, whole grains, complex carbs, chia seeds, flax seeds, all of those good things, they also have a lot of vitamins and minerals in them that just improves the quality of your diet. This is a very lofty goal of 30 grams per day. The average American takes in, I think it's like 13 grams, may even be 9. It's been a hot second since I've looked at the actual stats, but it's pretty low. So 30 grams a day is aggressive. And so, like I said, working with a registered dietitian can give you a sense of what those patterns should look like. But if you are not getting 30 grams per day, you are not alone. Like I said, I'm really just setting you guys up for success with showing you like optimally what it should look like. But most days I definitely don't get that at all. And then the last thing about fiber is I want you guys to really be savvy. One of the things I see a lot of people saying is, well, I eat multi-grain Cheerios or I eat multi-grain toast. Multi-grains just means many grains, none of which might be whole. So you always want to make sure if your intention when you're looking at complex carbs, like, breads, pastas, rices, things like that, that you're looking for, the word whole grain or the word whole wheat. Like I said, multi-grain, just means many grains, none of which may be whole. So when you get a whole grain, you're getting all of the nutrients, you're getting obviously the fiber, you're getting the vitamin E that might be embedded in the kernel. So you're getting a lot of nutrients in there. So those are my 5 tips for your diet. Once again, I know that it's going to be different for everybody, but like I said, if you can start working with a registered dietitian and, they can really help you zero in on what this needs to look like for you. Okay. Saying to somebody, you need 30 grams of fiber per day is like talking a whole different language. So that's why it's important to work with a professional that can kind of show you what that looks like based on the foods that you like in your diet. I just want to finish up with talking about exercise. Once again, I know there is so much hype. There's so much bullshit about what to do, what not to do. It's like, I don't know why in life we just need to complicate everything, but I'm here to tell you probably something you've already heard. I don't have any tattoos, but if I did, I would have 2. My right arm would say consistency and my left arm would say patience. That would be pretty cool if I had an arm sleeve, but I'm not brave enough to do that. But those would be what I would say. And so that's what I'm going to say to you. Consistency in your exercise program is going to trump anything. And so it's so important to start where you are, right? A lot of women who have PCOS, if they're overweight, they feel uncomfortable in their own skin. And so going to a gym is just probably not the first thing on their list that they want to do. So starting where you're at with what you have, which we're going to talk about, is what's going to be most important. Okay. But like we've been talking about weight loss and PCOS, the cool thing about exercise is there's literally nothing that exercise doesn't help improve. It improves blood pressure. It optimizes blood sugar and diabetes. It makes your body, especially weight training, it optimizes and makes you more sensitive to the effects of insulin circulating. It optimizes mood. It improves bone density. And one of the cool things, once again, about strength training is that it increases your metabolism. We have seen this a gazillion times in my practice because we can measure your metabolism. And so we can see the impact of a training program on you. The only thing that is going to increase your metabolism is going to be adding some more lean muscle mass to your body. And even though you may have elevated levels of testosterone, they are not going to get you big and bulky. They're not at that excessive level. So don't worry about, weight training and it being disastrous. So, like I said, while I want you to start with what you have, I also want you to aim for some goals. If you guys know me, many of you do, I'm a gal that loves goals. So, the long-term goal for somebody trying to lose weight, the long-term goal for anybody is 150 minutes of moderate exercise a week. Okay. And when I say moderate, that means that you can talk, but you couldn't sing while you were working out. And honestly, I don't really care what that 150 minutes looks like. But what I would love to in the long term see is at least 2 strength training workouts per week. Okay. I'm a huge fan of efficiency, meaning I just like things easy. So those 2 strength trainings could be full body. They could be with your own body weight. They can be whatever you want. But I think what a lot of women with PCOS do is they really prioritize cardio, which I want you to have in there, but I also want you to, I also want you to, to long-term think about considering some strength training. But some easy places to get started would be walking. If you are on the East Coast, we've had a phenomenally mild winter and the weather has been awesome. So whether you are getting out there for your 150 minutes and you're walking, you're hiking, you're doing yoga. 2 things that I really just recently realized, and and literally because I love me some women with PCOS and I'm constantly thinking about you guys, is that I recently started doing Pilates and bar. And I used to think it was a whole bunch of hocus pocus and bullshit. And as somebody who was a Division I athlete, I thought I was going to go in there and basically bench press the instructor over my head and do tricep curls with it. That's how strong I felt I was. It was such a humbling experience. And I'm not talking about the reformer. I'm talking about bar and Pilates that you can do at a lot of gyms. I just feel like it is a good point of entry that doesn't involve really heavy weights. That is a really good workout. So if you're thinking about branching out of doing something, that's not, walking or hiking or yoga at home, riding your bike, jumping rope, playing some tennis. I really it's so funny. I'm not a cult follower because I haven't done it long enough, but I keep on saying to my instructor, this would be so, can we do a PCO? Can we get some of my PCOS peeps here? This would be so good because there is a decent amount of strength training, but it's not with really, really heavy weights, but it's it's hard. And I keep on thinking it would be a really good point of entry, especially, for women in this type of environment. So I'm a huge fan of that. I like to look at some of the research to kind of see, if there is any, involved, with PCOS, but it's really about starting where you are and just being consistent with it. Right. So if you don't feel super comfortable going to a gym, whether you be walking, go to TJ Maxx, get some bands, get a jump rope, YouTube, a lot of my clients do, they do a bunch of stuff at home, YouTube channel, join a hiking club, they have a lot of those Leslie Sansone walking videos. Like, I don't care what you do. I just want you to be consistent with it. And I want it to not be painful. I don't think you're going to love it because like like I said, I've been an athlete my whole life and I don't think I've ever loved any 1 second of it. But like I said, as I get older, I feel like I choose things that I look forward to, so you do want to get up a good sweat. Like I said, 150 minutes of moderate exercise per week, and then at least 2 strength training workouts would be great. And then, like I said, let's wrap this up by how do we make this work for you? Okay, so the most important thing, and I think this is probably the hardest thing for women with PCOS to do, is make yourself a priority, okay? Because if it's like that analogy with the oxygen mask, right? If we don't take care of you, like you can't be the best version of yourself for anybody. And more importantly, you're fucking important. So we need to make you a priority, and we need to prioritize your health, your wellness, your mental health. We need to get you moving because you're important. At the end of the day, that you're important, and that matters. You want to get yourself an A+ team. Like I said, if you need suggestions for docs, OBGYNs, fertility centers, registered dietitians, therapists, dermatologists, spas for laser hair removal, like we want to hook you up with a team that feels good for you. Like nobody should ever make you feel worse when you go to see them. So if you don't love your team, like let's work together and find a team that works for you. Number 3, give yourself grace. Like this shit is like no joke. And then give yourself grace again. Having PCOS is like having like a 30 to 40% handicap when it comes to doing most things related to weight loss. So you're coming at this at a disadvantage. We're going to optimize you and give you all the tools you need in order to be successful, but you got to give yourself grace because your deck is not full, right? We're going to help you optimize it. And then number 5, focus on what is important to you, right? So if you're working with a provider, you want to make sure that it's not about their agenda, right? That you have some say into what you're working for, what you're working towards, and what is important to you. Like I said, at the end of the day, when we're working with clients in my practice, like I said, it's about meeting them where they are, not where there should be. Okay. And if you need a registered dietitian, you guys know I have the most badass team over at the Plano program. I love, love, love my team. So we accept all commercial health insurances. So everything from Blue Cross Blue Shield, Cigna, United, Aetna, Emblem, Harvard Pilgrim, Connecticut, and the majority of all of your insurances will cover unlimited visits with us, for most of the disorders. So if you're looking for a registered dietitian, we can hook you up. We meet you where you're at. We can also give you a customized meal plan if that is what you need. Okay. I'm air quoting really hard behind this screen need. Most patients do not need customized meal plans. They need accountability. They need support. They need education. A meal plan is generally far from what they need. But if that's what you and I and my team decide you need, we're happy to work on something customized based on your meal plans. But that's generally not where we start with our patients. We kind of start with the education piece. And lastly, one of the cool things we do, although it's not covered by insurance, is we do metabolism testing. So if you're local to us, and just to recap too, we do both telehealth and in-person visits. And then we do metabolism testing, and where we can get your exact resting metabolic rate, so you know exactly where your calories are. We don't really love to guess with our PCOS patients because there's so much going on. So if we can get them to run their metabolism, see exactly where it's at, then we can kind of work in reverse, and we can say, okay, this is where your calories need to be. We need 30 to 35% coming from carbohydrates. We need X amount coming from protein. We need X amount coming from fat. So if you have the ability to have your metabolism tested, that is an awesome thing. So I would love to take any and all of your questions and see how I can help, because I know that this is a very overwhelming topic. So let's see. I know we have one in the chat. Cool. Somebody said, how do you go about getting recommendations for you for those types of providers you mentioned? So absolutely. So if you want to just shoot me an email, I'll put my email below. If you tell me what state you're in, I can always connect you with the best set of providers for what you're looking for. Because I think it's really important that you have a team that you feel super comfortable with. I think, like I said, having PCOS is like getting handed like a shit stick. So if we can at least hook you up with the right people, then we can get you going in the right direction, like I said. Any other questions, even from registered dietitians? Anything I can help with, anything that's confusing when you guys are working with your patients? Great. So good question. Can a vegan diet be beneficial for somebody with PCOS? What would be some good sources of protein for them? Great question. So as a former vegan, I was a vegetarian for 15 years. I was a vegan for 2, and I was a raw vegan when I lived in Costa Rica, and I didn't eat anything above 106 degrees. And I was also really crazy. So like, I think when I'm working with my clients, I really want to know their reason behind it. When I was a vegan, a vegetarian, like I know, like while I really loved animals, I felt like it was more tied to my identity. So it was more of like an internal struggle than it was an actual real struggle. So if somebody they come to me and they're ethically want to follow a vegan diet, I totally honor and respect that. It's not impossible to do with PCOS, but a lot of times you're working with a couple limiting factors, right? I try, if all possible, not to do a ton of like meat analogs, because those tend to be pretty high in sodium. So something like an Impossible Burger, while it is a meat substitute and it is high in protein, it's also really high in saturated fat, and it also has like, refined coconut oil in it. So a lot of times I make sure, like, I just want to kind of see where my clients are at in terms of what are they willing to eat? What are they eating currently now for protein sources? Like I said, I'm not a super fan of like pea-based proteins, but that tends to be a good choice. And you can kind of do like smoothies and shakes and pancakes and waffles and stuff like that. Obviously like legumes are a great source. But we're going to have to balance those out with the carbohydrates. So like, you know what I mean? We're just going to make sure that, if we're going to give them rice and beans and some veggies, which is not a bad source, we're going to make sure that we're really rounding out and giving them, more vegetables there. Obviously tofu, if they're, organic tofu, if they're willing to do that. Seitan, if they're willing to do that. Once again, we just have to kind of watch tempeh. So any of those sources are fine. I just try to see where they're at and what they're willing to do, in terms of those protein sources. Because I know that, sometimes it can be very limiting in terms of what people are actually willing to do there. Do any other dietitians have anything that they can add, or anything that they've had good experiences with their clients with vegan diets? Yeah, like I said, I really struggle. Like I really want to know the root of why it is somebody is a vegan. I know it's generally none of my business, but I'm sure I make it my business if you know me. Because I think optimally long-term, that can turn into a pretty high carbohydrate diet. It's not adverse to see patients who have followed vegan diets and have elevated triglycerides and have elevated cholesterol levels. You know what I mean? So just being really mindful of that and kind of seeing where they're at. But like I said, I'm not adverse to it, and we can certainly work with them. But I kind of want, I don't know. I like to know a lot of information when I'm working with them, because I want them to be able to sustain it long-term. I've been eating meat since I met my husband, so probably for the last 10 plus years. And before my dad passed away, and I made up for all the meat that I didn't eat when I was a vegetarian. Like to my dad's dying day, like he still thought I was a vegetarian, like even though I've been eating meat for such a long time. So sometimes it just becomes part of your identity, whether or not you want it to be. So I think like the sustainability factor for somebody, just making sure that if that's what they want to do, also explaining to them, how it will be challenging to manage their carbohydrates. Grace asks, do you recommend HIIT versus steady state cardio for clients, particularly if they are starting at some base of exercise and not from zero? Yeah, I mean, I think when you look at the research, I think it's the majority of women with PCOS, I think to your point, they are generally starting more probably like on a 2 or 3, in terms of where they are cardiovascularly. Why some of the studies say HIIT training, so high interval training, is not awesome for them is that it tends to elevate their levels of cortisol and keeps them high for a longer period of time. I think if you look at true HIIT and short-term HIIT, so more like, without getting technical, like a Tabata, which is a short version of HIIT, right? It's like 10 seconds on, 20 seconds on, or vice versa. When you look at that duration, I think that shorter stress on the body of high intensity cardio can be really good for them. But doing something, I think, like a CrossFit, where there is some metabolic training involved, I actually think that that can be kind of, not awesome from a weight loss standpoint. There is some research also looking kind of at that new thing that's all the rage, which is, it's new now to social media, but that 30 minutes on the treadmill at an incline of 12 at 3 miles per hour, kind of looking at, that's more steady state cardio. And they look at that and they say, like, what is somebody's heart rate at that? You know what I mean? Like, can they keep it at a good zone where it's not spiking for a long period of time? So the detriment, quote unquote, of HIIT for too long of a period is that it can increase levels of cortisol, which, women with PCOS, their hormones are already out of whack. So that's why sometimes steady state cardio, as long as their heart rate's on the lower side, it's not too much stress on the body. But the reality is, like, at this point, a lot of times we're splitting hairs. And so if somebody's not losing weight, a lot of times, it comes back to their diet before it comes to exercise. So, I would love to just see more people move, than worry about what they're actually doing. Like I said, and then get some quality strength training in there. I think too much cardio for anybody can also be a metabolic disaster as well. So I think, like I said, I would do some shorter term duration. Like I said, if they were more of like a high quality, like you said, your premise that they're not baseline 0, I probably would do some, higher intensity, but like at a lower time frame, and make sure on the back end that they are doing some strength training, of some sort to, offset that as well. But that's a great question. Let's see, I gotta put my glasses on because I'm blind as fuck. Okay. Somebody said, I just actually bought a Vega protein powder, which is pea-based. Should I avoid it? Not sure if this is too specific. No, that's a great question. I think of all the vegetarian protein sources out there, I think that's probably the highest quality. My background is in sports performance, and I worked in a protein lab before I became a registered dietitian. And so to me, like, protein is kind of near and dear. And so historically, if you ask somebody in protein research, they're going to tell you that a pea-based protein is not a complete protein based on, the amino acid score. For 99% of the population, a pea-based protein is a great choice. What I want you to notice about that actual product is, while if you bought an egg white-based protein or a whey-based protein, the carbohydrates on that would be 0. When you look at the pea-based protein, I think per most scoop, it depends on the brand. We actually had some Vega here. I think it was like 7 grams per scoop maybe. So we would just have to make sure that we were offsetting some of those carbs, right? Like if you buy Shakeology, I think that's a pea-based protein. That's got about, or an Arbonne, those, they do have some carbohydrates in it. Once again, it's still a pretty high quality source. I just want to make sure it also tastes good to you. Some of the vegetarian sources taste like dirt. And so it's just not going to be sustainable long-term. The other one, so some of the brands that people like for protein powder, they like Orgain. I think Orgain also has a vegan-based one. People like J-Rob, Optimum Whey, obviously those are dairy sources, but my favorite of all times is still J-Rob. To me, it's like the cleanest tasting. I'm not like even though my background is in protein, like, I can't, like, protein shakes, like, they're just not my thing. But that's a great question. Even in terms of specific brands, I'm like a food whore. I can tell you, I'll give it to you straight if I know the product. Heather has a good question. Do you focus on calorie deficit or more balancing out macronutrients or focusing on a low carb diet? Great question. It really depends kind of where they're at. So in terms of when they're starting out, so like, it's like, is their diet, which is totally normal. Like, is the diet like a dumpster fire, right? Like, is the building burning and everything is going down? So in those scenarios, I'm probably going to start to focus, kind of more on those major pillars that we talked about tonight. So tip number 1, tip number 2, if somebody comes to me and they're super frustrated and they've been doing everything they possibly could do, I am probably going to get a little bit more complicated, and I'm actually going to put them in a deficit, and then I'm going to cycle their carbohydrates. So I'm probably going to go like 3 days at 100 grams of carbohydrates, and maybe their third or fourth day, I'm going to bring up their calories, bring up their carbs. So it's almost like a little bit of metabolic disturbance. So it really, like, once again, that's my ace in my hole. Like when it's like I get a lot of patients that are so frustrated. And so that way I can kind of keep them sane. And so like from a sports performance standpoint, that's kind of what we would call like a refeed day. And so I keep them low, 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 and then I jack them high, and then I go low. So it is a deficit on those lower carb days. But then it gives them some fun food on the weekend. And so like, if somebody says to me and I'm doing a meal plan, which has been a hot second, like I might put alcohol and a burger on that, like day 3 or 4, you know what I mean? And then the next day I'll drop them back down to 100 grams. So I'll say to somebody like, what do you love to eat? Like, what's your favorite food? Like, what do we need to include? And they'll be like X, Y, and Z. And I was like, awesome. Like, let's do that on your higher carbohydrate day. So then, you feel satiated, because to me, it's all about like sustainability. And that's like why, like if somebody, like to me personally, like the Whole30, like I could never give up pizza. I could never give up cheese. So like something like that, I often say to my patients, like, we need to be able to do this day in and day out, so I do like to put them in a deficit, but I may not start there because, we may have so many competing factors going on as well. So, and it's like, I think the tricky part about losing weight when you have PCOS is a lot of times you don't live in isolation. You're a mom, you're a wife, you're a significant other, you're a teacher, like it's like you're out there in the world, and like, microscopically managing your diet is probably just not, it's just not what you can do. So, I really like, that's why I think it's so personalized, and also explaining, as long as somebody like, it's like, I've got an end game for like everybody, when I work with them, but where I am and starting with them now is probably not where I want to be. You know what I mean? It's not going to be where I am with them, with 3 to 6 months down the road, so I think it's really important to meet them where they are, but also have super realistic expectations. You know what I mean? And so that's why, like, if somebody goes on a really low carbohydrate diet, as we all know, every 1 gram of carbohydrates pulls in 4 to 6 grams of water. So as soon as we start to unpack some of those carbohydrates, right, we're going to be pulling some of the water off of them. And so we also have to be realistic with them and say, wow, it looks like you lost like a decent amount of weight. But remember, they were also probably fluid overloaded when they started working with you. Just by nature, they were eating more carbohydrates. You know what I mean? So like, keeping it really real with them. And I think even as a provider, it can be really frustrating. You're frustrated for them. Like there's been times when it's like my patients have left and I'm just like start crying because it's so frustrating watching somebody work so hard. And so sometimes as the provider, you have to think somewhat unconventional. And I think for me, going back to my roots when working with athletes and trying to drop body fat and get them, in season, just making sure like I got a little bit creative, and then I really realized some of those things were really helpful. Patricia asks, are there specific foods that you would highly recommend for people with PCOS to manage their symptoms? No, definitely, really good question, but not, you know what I mean? Like, because it's like, everybody has such a different eating palette. And so when somebody like, and there's so many different cultures. So it's like, for me, it's like, there's no foods that I tell them they have to eat. I really generally will start, I'll say like that for me, having them keep a food journal so I can see how they eat now, right? Because what I want to do as a provider, I don't really want to change the way they eat, right? I really want to kind of tweak the meat, you know what I mean? To me, sometimes I'm like, what is the lowest hanging fruit? You know what I mean? Is it like, because it's generally, one or two things that stands out. And so it's not about taking away their rice if they're Hispanic, you know what I mean? It's about, okay, like, it's like, where do you know how many grams of carbohydrates you might be consuming from rice? And so it's really fun to watch people learn and say, oh shit, like I didn't know that, you know what I mean? I knew that I was eating a lot of rice, or carbohydrates, I just didn't know where they were coming from. So for me personally, like I said, because I'm such a weird eater, like I really try to see what's sustainable for them. Like I said, I do really try to focus, like, you know what I mean, on making sure that I'm giving them enough protein, because I think that the key to success for weight loss is really tragedy averted, right? So it's like, it's being prepared and doing the things we probably don't want to do and don't want to eat so we don't derail later on. You know what I mean? So if we can keep them like 80 to 85% kind of where they should be, that extra 15%, you know what I mean? Like, let's let them live, you know what I mean? So that's why I don't think, me personally, I haven't ever really restricted anybody's food choices. And even managing their symptoms, if we can get them to, you know what I mean? One of the cool things, and why I know people are anti-weight loss and PCOS, but for me, I'm so pro it, that it's like, if we can get them to lose weight, right? Even 5 to 7% of their weight, it's like, we can lower, we can make them more sensitive to the effects of insulin. We can optimize their fertility. We can decrease their risk for cardiovascular disease, decrease their risk for metabolic syndrome. So it's like, we can help them, like, get their whole lives back on track. You know what I mean? And so, like, I just think that's so cool. It's like, it's also, like I said, there's definitely moments, there's probably not, like, working with no other population have I ever been so emotional, but it's also really fun to really see that the power is really, the power to change somebody's life when it comes to PCOS. That's the first line of treatment, right? Like, even though we talk about inositol and we talk about metformin and GLP inhibitors, like, the reality is that, like, we have to change their diet and lifestyle in order to optimize their life, to give them their life back that they deserve to live, so that's why I think it's really about running the marathon and explaining to them that, and like I said, they've been through so much. It's like, it's insane, you know what I mean? So, but I don't know, it's like an honor for me. It's like an honor and privilege. Like I can't see my life as a registered dietitian, like working with any other population. Like, it's just like, it's been so rewarding, but also so challenging, because if anybody's ever worked with somebody with PCOS, it's like, sometimes you're between a rock and a hard place. But I also think it's in those moments as registered dietitians that we also get better. You know what I mean? And that while we may not be able to solve all of our patients' problems, it also kind of forces us to think and really think, okay, like, what else can I do to help this patient? All righty, friends, I'm going to shut up. I know I talk too much, but I love you guys. Thanks for hanging out. I will figure out a way to get you guys the replay, and then I will figure out a way to get everybody the slide deck as well. Okay, guys, good night.